Thank you for choosing the BNMS YouTube channel. My name is Simon Hughes. I work as a consultant in radiology and nuclear medicine in Birmingham in the United Kingdom. This is part of the Applied CT Anatomy course for PETCT and SPECTCT reporting. This presentation is part of the BNMS YouTube channel collection. The information provided in this presentation is the responsibility of the presenter and does not represent the views or opinions of the British Nuclear Medicine Society. Content is provided for education and training purposes and should not be interpreted as medical advice. If you have concerns about this presentation in any way, then please contact us directly and we will be happy to investigate further. On this axial slice, we can see the frontal lobes and the temporal lobes. If you click, these will appear shown by the red calipers and yellow calipers. If we take a magnified view of the suprasellar cistern and you click again, we can see the red arrow showing the optic chiasma. The yellow arrow shows the pituitary stalk ascending out of the pituitary fossa to pierce the diaphragmatic cellar. We see the right and left middle cerebral arteries, the major division of the anterior cerebral artery. Posteriorly, within the suprasellar cistern, we see the basilar artery. This is indicated by the pale yellow arrow. So this is the confluence of the vertebral arteries that we'll see later on. And we see on either side of the basilar artery the superior cerebellar arteries coursing on either side as part of the branches of the basilar artery. The red oval shows the pons, and posteriorly coursing into the right and left cerebellar hemispheres are the middle cerebellar peduncles. If you click again, you'll see an expanded view of the part of the posterior fossa, and the large red arrow will show the inferior part of the quadrigeminal plate cistern. The aqueduct will not be seen on the CT scan. The green arrow shows the petrous temporal bone containing some mastoid air cells, and we see the tentorium cerebelli indicated by the large yellow arrows. These two images are from Gray's Anatomy and are going to give us an idea of the dural reflections around the brain, and those dural reflections containing important veins, and we can see these structures on the CT component of PET-CT. So there's a major midline reflection of the dura called the falx cerebri, and this is going to divide the right and left cerebral hemisphere from each other. Extending, dividing the anterior and the posterior cerebral space is the tentorium cerebelli. So this is the reflection we saw on the previous CT scan. So this is a reflection of a dura extending from the lateral aspects of the posterior cranial fossa and then extending medially to insert into the posterior part of the falx. The free edge of the tentorium surrounds the brain stem. So on the right hand image we can see this as a lentiform space. This is the space which causes severe problems when there is intracerebral edema and brain swelling, and you can get herniation and compression through this small space. We can also see the diaphragma cella. So this is the dural reflection over the roof of the dorsum cella, containing the pituitary fossa and its contents, and we'll discuss those in more detail. So importantly, within these dural reflections are draining veins. So in the superior part of the falx cerebri we have the sagittal sinus. So this is going to course and drain posteriorly towards a confluence of multiple veins called the torcular. So the torcular receives the sagittal sinus and also the straight sinus. So the straight sinus is going to drain the inferior sagittal sinus in the free edge of the falx cerebri and then drain into the torcular at the junction of the connection of the tentorium cerebelli and the falx cerebri. So once we have a confluence of the superior sagittal sinus and the straight sinus, then these drain on either side at the root of the tentorium cerebelli as the transverse sinuses, and these are then going to drain into the sigmoid sinus, and then they're going to form the internal jugular vein. We can also see at the anterior lateral reflections of the tentorium cerebelli, we can see the superior petrosal sinus, so the confluence of the transverse sinus and the superior petrosal sinus is going to form the sigmoid sinus. Here we have taken a further axial slice through the brain substance. If you click, we'll see a magnified portion of the central part of this scan. And again, if you click again, we'll see 2 yellow arrows and 2 red arrows. The red arrows indicate the anterior clinoids, bony projections from the base of the skull, and the yellow arrows show the posterior clinoids. So these are the bony projections which are going to support the diaphragma cella that we saw on the previous slide. In between these bony projections is the space called the dorsum cella, which is going to contain the pituitary, and the green arrow shows the pituitary stalk. So this is coursing out of the dorsum cella is going to pierce the diaphragma cella and is going to project into the hypothalamus of the brain. So you can see that the pituitary is the only extradural component of the central nervous system. Either side of the dorsum cella, we can see the supracavernous portion of the internal cerebral artery. So this is the right and left cerebral artery as they come out of the right and left cavernous sinus within dural reflections on either side of the dorsum cellae. If we go back to the main image, again we can see the basilar artery in the prepontine cistern as part of the basal cisterns of the brain. The blue arrow shows the pons, and at this level the purple arrows show the inferior cerebellar peduncle, these low attenuating, very dense white matter projections into the cerebellum itself. If we look at an expanded view and within the red circle, we can see the fourth ventricle, and within it these slightly higher attenuation appearance of the choroid plexus within this part of the fourth ventricle. The black arrows show the right and left sagittal sinuses. So these are the extensions of the transverse sinus as they receive the petrosal sinuses, and these sigmoid sinuses are going to course through the foramen lacerum to become the internal jugular veins. You can see that the right sagittal sinus is usually larger than the left sagittal sinus, and again this is why the right internal jugular vein is usually a little bit bigger than the left internal jugular vein. In this image we see the sella turcica, a midline depression within the sphenoid bone. If you click, you'll see a magnified central portion again. The red arrows show the right and left greater wing of the sphenoid, either side of the sella turcica as this depression. The yellow arrow shows the posterior elevation of bone forming the dorsum cella. So this is going to extend superiorly and laterally to form the right and left posterior clinoids. The green arrow shows the petrous temporal bone on either side, and so attached to this is going to be the lateral attachment of the tentorium cerebelli. These collection of bony shapes are what are going to form or allow the formation of the pituitary fossa containing the pituitary gland. Laterally, around the sella turcica and laterally to the dorsum cellae, we see the high density blood within the cavernous sinus, and in the second magnification this is shown by the light blue arrows. We can just see some little nodules of calcification seen now within the cavernous portion of the internal carotid artery, This is seen especially on the left side. Remember, we previously saw the supracavernous portion of the internal carotid artery before it divided to form the dominant right and left middle cerebral arteries that we had seen previously. On this anatomy photograph we can see some of the pituitary structures. If you click, you'll see a magnified view in the region of the pituitary and the sagittal plane. The red arrow shows the white matter of the optic chiasma within the suprasellar cistern above the diaphragma cella. Within the pituitary fossa, inferior to the optic chiasma, we can see the crescent-shaped and posteriorly positioned normal pituitary gland. The pituitary stalk is going to extend posteriorly from this crescent shape and pierce the diaphragma cella. We can see the floor of the pituitary with air within the sphenoid sinus. The green arrow shows the dorsum sella as the bony posterior extent of the sella turcica, and you can see that this is contiguous inferiorly with the clivus as part of the base of the skull, indicated by the light blue arrow. This is a cartoon from Gray's Anatomy showing the important structure of the cavernous sinus. We have seen this already on some of the previous axial CT slices. The cavernous sinus is a venous sinus with important connections to both the face via the ophthalmic veins, to the sphenoid bone and sphenoid sinuses posteriorly, medially, to the brain that surrounds this region, and drains via the inferior and superior petrosal sinuses that we have seen on some of the other cartoons. Importantly, it contains the internal carotid artery, so this is the cavernous portion of the internal carotid artery that again we've seen previously on one of the CT slices. The abducent nerve, the sixth cranial nerve, is truly within the sinus, and the other four nerves seen in this region, the oculomotor, trochlea, and the ophthalmic and maxillary divisions of the fifth nerve, are placed between the sinus and the dura itself. On this axial slice of the CT, we are starting to enter the true anatomy of the base of the skull. The red arrow shows air within the sphenoid sinus, the part inferior to the pituitary fossa that we saw on one of the previous slides. The yellow arrow shows the bone density within the clivus as part of the bony structures of the base of the skull. The pale green arrow on both sides, here only indicated on the left side, we see calcification of the internal carotid artery running within the base of the skull within the carotid sulcus. The large green arrow on the left shows the petrous temporal bone, and the light blue arrow shows how this contains the middle ear structures, and we can see some air within the superior part of the external auditory meatus. Note posterior to that the aeration of the mastoid sinuses that again we've seen previously on CT slices. The white arrow again shows the more inferior portion of the basilar artery that's forming from the two vertebral arteries, and the red circle shows the pons. So the basilar artery remains within the pre-pontine system. The yellow oval shows the supraorbital frontal cortex on the floor of the anterior cranial fossa. And as we descend through the roof of the left orbit, we start to see part of the superior rectus muscle. In the last few slides of this talk, we're going to have a look at some coronal images, looking at some of the relations of the sinuses and venous sinuses that we've seen on previous imaging. So on this image we can see that the red arrow shows the straight sinus. So this is the sinus running at the junction of the falx cerebri and the tentorium cerebelli, and is going to drain the inferior sagittal sinus and also some of the deep veins, the great vein of Galen, from the deep structures of the brain itself. We can also see the lateral or transverse sinuses running in the reflections of the tentorium cerebelli laterally. This is a coronal slice taken now slightly posteriorly. The two red arrows show the paired internal cerebral veins within the deep structures of the brain. So these are going to coalesce into the great vein of Galen, and as they travel posteriorly are going to drain into the straight sinus that we saw in the previous slide. The yellow arrows show the choroid plexus and the floor of the lateral ventricles that we've seen in previous talks. And again we see the tortuous sigmoid sinus with the right larger than the left that we've seen elsewhere. So these are going to drain into the internal jugular veins. This is a further coronal slice, again slightly posteriorly. The red arrows show the posterior cerebral arteries, and these are the final branches of the division of the basilar artery that we've seen on multiple slices before. And the basilar artery is formed by the coalescence of the vertebral arteries, and the yellow arrows show the vertebral arteries entering the brain through the foramen magnum. So these vertebral arteries have ascended through the foramen transversarium of the cervical spine and are entering the brain to form the posterior circulation of the brain itself. The green arrows show the jugular bulb. So this is the transition of the sigmoid sinus to the internal jugular vein. And again you can see that the right is slightly larger than the left, which is the most common finding. This is now a further coronal slice, and you start to see we're entering the region of the cervical spine. We see with the red arrow the confluence of the vertebral arteries to produce the basilar artery, and the yellow arrows show the branches of the basilar artery as part of the posterior circulation. We can see superiorly the division of the basilar artery, and in this case with a dominant right posterior cerebral artery. So this is the artery that we saw on the previous study. And now we see the origin of the internal jugular vein that's exiting the jugular foramen. And more inferiorly, we see some of the tortuosity of the vertebral artery as it exits the foramen transversarium of C2, loops around the C1, and is going to enter the foramen magnum to form the basilar artery itself. This coronal size is now at the level of the odontoid peg, and we can see the internal carotid artery within the carotid sulcus. So this is the red arrow. We can see it coursing superiorly either side of the air within the sphenoid sinus, indicated by the yellow arrows. So this is the internal carotid artery within its cavernous portion. It's going to become the supracavernous portion and is going to divide to form dominantly the right and left middle cerebral arteries, and these are indicated by the green arrows. And we can just see a small portion of the left anterior carotid artery as a smaller division of the left internal carotid artery. So thank you for choosing to view this educational presentation on the BNMS YouTube channel. There are lots of other applied anatomy CT components extending from the base of skull inferiorly, and hopefully you'll find these useful. Thank you for listening.